One of the things that I do is I teach a clinical class, and it offers students an opportunity to learn how to listen the way that a therapist might listen. And students, so they're able to practice their listening skills. Now, obviously, these students are not being trained to be therapists, but they're getting some basic hands-on experience with learning how to listen in a therapeutic way. One of the other things I'm working on is trying to take students to different sites in the state of Ohio that have to do with kind of the history of psychology. There was also a professor who retired who left a bunch of historical artifacts, and so we're working on kind of categorizing those and cataloging them. And then in my research lab, I was able to take a student to Peru, which was really fun, and we were able to learn research sort of in this other country, which was an amazing experience.
In our area, hands-on learning is so important because a lot of the job is based on using your hands to work the equipment or to streak the agar plates or to draw specimens up in pipettes. Having good hands-on skills is vital to the laboratory scientist. And in our student laboratories and a lot of the exercises we do, that is a main focus. So we want the students able to work the equipment here on campus and get all the kinks worked out before they go out into practice. That way we know when they're measuring things, when they're putting test reagents and components together, that they're being able to do that appropriately. And also I think students in this day and age are just so much more engaged when they learn by doing. So in our MLS program, I try to incorporate as many hands-on activities as I can, and then kind of bring in the theory and the principle amongst those activities.
I think the one, especially with our clinical tract in PT and OT, that is a pre-preparatory graduate track. Over the past few years, we've seen majors at Gannon, Walsh, PT School, Ohio State Physical Therapy School, University of Dayton, as we look at that. And our placement rate overall is over 90% within those grad programs or within the field. And you don't always have to go to grad school. There are a number of opportunities outside of there where we can have employment. And again, the employment list on our PT or our clinical side is around the similar places. They're at Cleveland Clinic. They're at some of those where we've created internship opportunities. We see a lot of the interns kind of slide into those, which of their job opportunities from an internship opportunity, which we think is great. Along the lines of the strength and conditioning, we have the head strength and conditioning with football at Michigan State currently is a ONU grad. The head strength and conditioning coach at Tiffin University is an ONU grad. So we have people in the collegiate setting, as new as we are, we have people out there currently also.